I will be performing the bed bathing of a conscious patient. The first thing that we should do is to apply a pair of clean gloves to prevent a cross-contamination. Next is prepare equipment and supplies. This is to avoid interrupting procedure or leaving patient unattended to retrieve missing equipment. In washing the face, place towel under the head and then ask if patient is wearing contact lenses. This is to prevent accidental injury to eyes. And then fold washcloth around fingers of your hand to form a mitt. Mitt retains water and heat better than loosely held washcloth, and this is to prevent from splashing. Bathing eye from inner to outer canthus prevents secretions from entering nasolacrimal duct. And then use different suction of meat for each eye. This is to reduce infection of transmission. And then do the same procedure in washing. Again, fold washcloth around fingers of your hand to form a mitt. This is to retain water and heat better than loosely held washcloth, and this is also to prevent from splashing. Next is dry the face using the towel under the head. And then remove the towel to proceed to the upper extremities. Place bath blanket over patient and loosen and remove top covers without exposing him or her. This is to provide warmth and privacy during bathing. Place bath towel lengthwise under arm. And then remove bath blanket from patient's arm that is closest to you. This is to prevent soiling of bed. In doing the procedure, again, fold washcloth around fingers of your hand to form a mitt. This is to prevent from splashing, and it is to retain water and heat better than loosely held washcloth. Bath arm with soap and water using long, firm strokes from distal to proximal areas. And then raise and support arm above head to wash, rinse and dry axilla thoroughly. Movement of arm exposes axilla and exercises normal ROM of joint. And then do the same procedure in washing the hand. Raise and support arm above head to expose axilla and exercises normal ROM of joint. Dry the arm using another clean towel. This is to prevent excess moisture, which can cause skin maceration or softening. And then cover the arm with bath blanket and remove the under towel. And then move to the other side of bed and repeat the steps. Again, fold washcloth around fingers of your hand to form a mitt. And then raise and support arm above head to wash, rinse and dry axilla thoroughly. Dry using another clean towel to prevent excess moisture, which can cause skin maceration or softening. Since my patient is a male, fold lower half of bath blanket up to expose the upper extremities. This is to build up secretion soil surrounding skin sore faces. Again, fold washcloth around fingers of your hand to form a mitt. In cleaning, use a circular motion in cleaning the chest and abdomen. Do the same procedure in washing as well. Use another towel for drying. Do the same procedure. Place bath towel lengthwise under the back. And then assist the patient from moving to the side to avoid from falling. Now start the procedure from folding the washcloth around fingers of your hand to form a mitt. And then use a separate sections of mitt to reduce the infection of transmission. Do a circular motion in cleaning the back and in washing as well. And then assist the patient in placing back. Next procedure is place towel under leg and then covered chest and abdomen with bath blanket. Exposed near leg by folding blanket toward midline. Ensured other leg and perineum remain draped. This is to prevent unnecessary exposure. And then fold washcloth around fingers of your hand to form a mitt. Washed leg properly assessed for signs of redness, swelling, or leg pain. This is to support of joint and extremity during lifting prevents structures. Cleansed foot, made sure to bath between toes, cleaned and filed nails, and then use another towel for drying. Do the same procedure or steps to the other side of the leg. Place towel under leg and then cover chest and abdomen with bath blanket. Exposed near leg by folding blanket toward midline. Ensured other leg and perineum remain draped. And then wash leg properly. Cleanse foot. Made sure to bath between toes. Clean and filed nails. And then dry using another towel for drying. Place towel under patient's neck and bath towel over patient's shoulders. Placed waterproof pad under patient's shoulders, neck, and head. And then placed wash basin under end of spout. Ensured spout extends beyond edge of mattress. Cover a washcloth over eyes and then poured water over hair until completely wet and then applied small amount of shampoo. Worked up lather with both hands, started at hairline and worked toward neck, lifted head slightly to wash back of head, shampooed sides of head, massage scalp by applying pressure with fingertips. And then rinse hair with water, ensured water drained into basin, repeated rinsing until free of soap. And then use the towel under head for drying. And then assist patient to comfortable position with completed styling of hair, then left call light in reach. And then close the blanket first to remove the bath blanket. Arrange blanket for patient's comfort.